This ACR QD clinic is brought to you by RheumNow's coverage of ACR 2023. Whether you're in San Diego at the meeting or attending virtually from home, you'll benefit from following our coverage. Our case today is coughing up blood. A 24-year-old woman who has a 14-month history of lupus comes in. Her lupus was based on having a malar rash, swollen PIPs, proteinuria, and positive serologies. She's been taking hydroxychloroquine, prednisone 7.5, and the baby aspirin every day. The patient presents to the hospital with a 2-day history of acute dyspnea, a non-productive cough, hemoptysis, and fever up to 103. She also complains of headache and weakness. When you see the patient in the emergency room, the temperature is 103, the pulse is 116, the patient's breathing 28 times per minute, using accessory muscles. There is no hypotension. The rash of lupus is present. There is no distended jugular veins. There is no edema, but there are bilateral rales in the lung fields, worse on the right. Chest x-ray shows patchy alveolar infiltrates bilaterally with blunting of the right costophrenic angle. The heart size is normal. The blood gases shows a PO2 of 69, a pH 7.5. The white count's 11. The hemoglobin is 10, and the platelet count's 105. The question is, do you need a diagnostic test? And let's just do a multiple choice question. So to confirm the diagnosis which is in your head, would you order A, an anti-GBM antibody for good pastures? B, an open lung biopsy. C, culture of sputum. D, a response to pulse steroids. Or E, the correct response, sputum looking for hemosiderin-laden macrophages. That would be the most specific finding for alveolar hemorrhage, right? Would it not? The only other, maybe easier to get, more specific finding would actually be to do bronchoscopy and find blood, in the bronchi. Because if someone is spitting up or coughing up blood, you don't truly know whether it's coming from the lungs or from the GI tract or upper oropharynx. So again, getting it from sputum samples or directly from the lung is going to be your best way of diagnosing diffuse alveolar hemorrhage. We said at the outset, this patient has lupus. We don't need to be looking for, a red herring like Goodpasture syndrome, someone who's known to get or have the possibility of alveolar hemorrhage. Other causes of alveolar hemorrhage would include Goodpasture's, any systemic necrotizing vasculitis like GPA, patients with ITP, TTP, patients who have profound low platelet counts, even sarcoidosis. There's 1,000,001 causes. Paragonomyosis, I have no idea other than it's a parasitic infection which can cause this problem. And how are you going to suspect it? Well, when it's an acute bleed, it's usually an acute onset of dyspnea and shortness of breath. That is paralleled by hypoxia proven on blood gas or pulse oximetry. They may have a rapid drop in their hemoglobin such that they are anemic. On chest x-ray, they are usually shown to have patchy infiltrates, usually bilaterally. There may be a dominance of one side over the other, usually right more than left, but it can be either side, right? And the diagnosis is either based on bronchoscopy, bronchoalveolar lavage, getting sputum, and finding hemosiderin-laden macrophages. Whether there's a contribution, a truly diagnostic finding of a sudden lowering of the hemoglobin was 13, now it's all of a sudden 10, 5 days later when they're short of breath and they have patchy infiltrates, again, leads to the high suspicion that this could be alveolar hemorrhage. Treatment is obviously stopping any drugs that could be causing the problem, fixing the hematologic or vascular abnormalities that could be causing the problem, and then treating the underlying disease. I got to say that in my many years at Parkland, I've seen a lot of alveolar hemorrhage. Probably, and in my whole career, I've probably seen more alveolar hemorrhage due to lupus than I have due to vasculitis and GPA. But they're pretty close. That's kind of what I think what most rheumatologists are going to see. I've never seen a really good case of Goodpasture's. I've heard about it. Colleagues have had a case, but I've never actually had a case of Goodpasture's. So again, I just throw that out there for some perspective when it comes to what kind of diagnostic testing you're going to do. My bias, by the way, in lupus at least, is that patients should receive pulse steroids. If you I did a long time ago, looked at how lupus patients with alveolar hemorrhage fared when they got steroids, high-dose steroids, or pulse steroids. Clearly, survival was better with pulse steroids, in my opinion. More recently, Peter Merkel and others did the Pexivast study. I think that's going to be presented again at ACR. And last year, they presented another analysis looking at patients with diffuse valvular hemorrhage. You know, the previous Pexivast study, which looked at the utility of plasma exchange with or without steroids, showed really no utility in patients with vasculitis. But the last analysis, sub-analysis from last year, said if you had alveolar hemorrhage, the numbers weren't great, meaning they did not achieve statistical significance, but it certainly looked like there was a clear advantage to giving plasma exchange or doing plasma exchange in patients with alveolar hemorrhage and vasculitis. So I would throw that in the mix because there's a high mortality with this condition. Hope you found this interesting. I certainly did. I want to remind you, as you go to ACR, as you watch it from home, the one thing that you can do with our coverage is look at our live stream videos. We're going to be live streaming videos of our daily panels where we're going to recap day 1, day 2, day 3. That's going to be at 6 p.m. Pacific time, 9 p.m. Eastern time. You can catch that live stream, and the live streams are available on our Room Now webpage, our coverage webpage, our YouTube channel, Twitter, LinkedIn, and Facebook, all under Room Now. We're going to do live streams for all the daily recaps. We're going to do it for the Rheumatology Roundup on Friday at 12 p.m. Pacific time. A great way to tune in and hear from those attending and the experts on what they thought was really hot stuff from ACR 23. We'll see you at the meeting. Take care.